So the the PPP program, as I see it written most times,
Mhm.
that was part of the big $2.2 trillion CARES Act that was passed last month. In your view, at least, has Congress and the administration, and also through that CARES Act, have their actions been sufficient to protect private practices?
Well, they were sufficiently rapid in the first go around, so it did get monies out there pretty quickly. And more specifically, there was $100 billion as part of that larger package that is going toward providers and hospitals. So physicians, other type of providers, as well as hospitals are eligible for that money. And while I would say that based on our research and our data that is reflecting a 50% or more decrease in revenue, it's in for medical practices around the country due to the lack of volume, not the practices that are dealing with direct patients with COVID-19, but the lack of volume as a result of either patients not coming to the practice, they're concerned about it, or simply other factors such as stay-at-home requirements at the state level, as well as other requirements at the state level that have required a lot of medical practices, for example, gastroenterology practices who do a lot of endoscopies or colonoscopies or other diagnostic work um, or smaller procedures. They've been told to close their surgical centers and reallocate resources in terms of protective equipment to the hospitals and the front lines of the fight against COVID. And so, the money, it was an important immediate stopgap. And what we saw was $30 billion of the $100 billion was allocated, at least initially, to providers who had, let's say, a relatively uh, large Medicare patient population. So some 2019 data was used to benchmark off of payments that have now been sent to, I think it was last Friday, sent to physicians and hospitals to, again, just to help them to keep their doors open. But that hasn't necessarily been sufficient for every practice. We have clearly medical practices, let's say pediatric practices with lots of children, but not a lot of Medicare. Or we have OBGYN practices, again, not a lot of Medicare, but serving a very important function during this crisis that really hasn't, the need for care hasn't gone away, but the resources for those practices that have more modest Medicare has not been sufficient yet. So we are expecting more to be done. And again, there's so many different funding streams that I know it's hard for the folks viewing this and our MGMA members to kind of keep track. But again, the money that I tend to focus on right now, in addition to the Paycheck Protection money, is that $100 billion that was allocated, and only 30 of that has been allocated to date. So we are still seeing distributions of that money, and so more, I guess, stay tuned. More money is already past the Congress and is being distributed. It's just taking a little longer.